Do you know enough about dementia? 1 in 10 Singaporeans that are above the age of 60 has dementia. This is due to the increase in life expectancy and the rapid aging population that Singapore is facing. Thus, it is important that we have the correct knowledge about dementia in order to build a society where people living with dementia are understood, respected, and supported. So, is it true that dementia only affects the elderly? The answer is no. Dementia can also happen to younger people. There is a rising trend in young onset dementia in Singapore. Throughout the world, the number of persons with dementia is expected to increase from 40.1 million in 2015 to 55.4 million in 2025. Symptom onset happens below the age of 65 to approximately 5% of persons with dementia. This is defined as young onset dementia. The two main types of dementia present in young onset dementia are Alzheimer's disease and vascular dementia. Vascular dementia is where a series of mini strokes happens in the brain. Since it is related to diabetes and hypertension, the rising trend in lifestyle diseases could be a factor in the rising rate of young onset dementia. Each year, more than 100 cases of young onset dementia or young onset mild cognitive impairment are diagnosed at the National Neuroscience Institute. Compared with late onset dementia, persons with young onset dementia have greater economic and societal burden. Therefore, early diagnosis and treatment is important as it results in less cognitive decline, better clinical and functional status, as well as lower mortality.
People have the misconception that having memory loss equates to having dementia. As people age, it is normal to be forgetful. Forgetting where you put your keys, password for a site, or the name of a friend does not mean that you have dementia. Thus, not remembering things as quickly as you used to should not be a concern, as age-associated memory impairment is a normal part of aging. Dementia comes with many other signs and symptoms, not only memory loss. Other symptoms include difficulty in communication, trouble recognizing familiar faces or items, worsening of cognitive functioning such as problem solving, decision making, judgment abilities, or being organized. And lastly, problems with daily activities such as buttoning of shirt, dressing, and using utensils while eating.
So, is there a cure for dementia? Unfortunately, dementia is irreversible. As people may think that there are cures to dementia, they may look at supplements and vitamins for a cure. There is no proven study that proves that this is true. The main concern that people may face through believing this is that they are effectively limiting themselves from receiving proper care. However, there are ways to lower the risk of developing dementia as well as manage the conditions of dementia. Be physically active, keep blood pressure at a healthy level, exercise regularly, eat a balanced diet, quit smoking, go for regular health screening, refrain from heavy alcohol intake, be socially engaged.
Although there is no cure, there are both pharmacological and non-pharmacological methods to manage the conditions of dementia. Pharmacological methods such as medications which slows down progression of dementia and improve cognitive symptoms in Alzheimer's disease. Non-pharmacological methods such as reminiscence therapy, which elicits recall of past events and memories to stimulate cognition. Music and dance therapy, which facilitates shared activities that reduces stress and the need for medications to cope better with the symptoms of dementia. Cognitive stimulation therapy, which is delivered in a small social group setting involving cognitive-based activities such as puzzles and Sudoku, which is proven to help improve cognitive functions and quality of life. Dementia does not have a definite cure, however, with better support and care, the progression of the disease can be slowed down. Getting checked at the doctor can help determine the causes of the symptoms, which may also help lessen anxieties about why you may be experiencing said symptoms. And early diagnosis also helps to plan more for the future, as you get to decide what you want during each step of dementia.
Dementia does not signal the end of a meaningful life. A person living with dementia can still continue to adapt to life as it affects one progressively. That means they can still experience personal growth, relation growth, and enjoy meaningful experiences. A great support for people living with dementia would be to engage them more often, allowing them to still have a social life. There are dementia-inclusive incentives in Singapore that are being carried out by different sectors and partners in the community. It aims to create an environment that enables people living with dementia and their caregivers to feel inclusive in community life. These are the common misconceptions of dementia in Singapore. If you're interested to know more about the myths and facts of dementia, do visit www.dementiahub.sg for more information.